Okay, so thank you so much. My presentation will be a little bit different in respect to the other ones because I'm going to talk you about the psychophysical well-being and the mental health issues that are facing children and adolescents in Italy, and especially during the pandemic and after that. And as early as March 2020, the Italian National Institute of Health established the COVID-19 Emergency and Mental Health Working Group together with several scientific societies coming from child pediatry or also child psychiatry. And we defined a sort of guidance for supporting the physical well-being and the mental health of children and adolescents. And during the lockdown, children had to cope with several factors such as the school interruption, the restriction of mobility, closure of places dedicated to sport, non-access to parks and playgrounds. During their life in their houses, they had to cope with stress and family conflicts, difficulties in accessing distance learning, and also in some families also housing overcrowding. And all of these factors have created isolation and social inequalities, amplifying the risk for mental health problems. Already in May 2020, we suggested to ensure proximity and supporting for the caregiver, or providing emotional support and awareness, rebuilding habits and promoting activities and lifestyle, or ensuring and go back with educational activities in presence. All of these just achieving a sort of balance between safety and the social and emotional well-being in respecting the constitutional rights for education and health. Starting from November 2020, the Italian media started to talk about the problem of children and adolescents regarding the attempted suicide, self-harms, and so on. And there was a sort of call for action coming from the governmental institutions. We started to talk with the clinicians coming from different regions and services, and the governmental institutions such as the Ministry of Education, Ministry of Health, the National Authority for Children and Adolescents. And we also established a sort of a tavolo interministeriale between all the different kind of ministries talking about the pandemic and psychophysical well-being and the need. And we defined these documents that is there, but the problem is that we understood that also if the different ministries started to fund different kind of actions, there was a great lack of coordination between these actions. Starting from March 2021, we established a regional network coordinated by the ISS, starting to define and establish a sort of way to find a way to establish a sort of database for understanding the real impact of the pandemic, but in general to collect data on health issues in children and adolescents. I don't know if you know that in Italy, the only regions that have a database regarding the mental health are Emilia-Romagna and Piemonte. So it's very important to establish this network to also to understand if there are particular emergencies regarding this sector. We are now collecting and analyzing data from 12 regions, and these regions are collecting data for the 74% of the general population in Italy. So this is a a very representative sample. We are collecting data from the hospitalizations, and also we are going to analyze data from self-harm, attempted suicides, hospital data such as collection data from emergency room and consultation, and also analyzing data from Emilia-Romagna and Piemonte region. These are the first preliminary data on the hospitalization rate regarding this MDC-19, and that is a way to collect data on the hospital regarding the admissions. I just showed the data from Lombardia, a region from north, one of the center and one on the south. And as you can see, the green line is representing the average of the hospitalization rate from 2015 and 2019. The light blue line is representing the 2010 and 20. And as you can see here in all the regions considered, there was a sort of going down from March 2020. That was when the lockdown started, and now is going a little bit up, going back to the average from the 4 years before of the pandemic. When considered the sort of incidence rate ratio, and just in respect of the reference year of the 2019, you can see that in all the regions there was a sort of decrease in the number of hospitalization for the mental disorders in the 2020, as it was expected. But in the 2021, in some regions such as Lazio, Lombardia, Emilia-Romagna, and Liguria, there was a great increase in respect to the numbers that we had in the 2019 before the pandemic. And when you are going to look specifically in the diagnostic code, we have problems on the affective syndromes and eating disorder, especially in girls, and addiction and abuse. This is especially in the northern Italian regions. I'm going to show you here some data coming from the Child and Adolescent Psychiatry Unit from Emilia-Romagna regions. This is a big problem that we are facing with regarding the eating disorders. These are the diagnoses, the new diagnosis. As you can see here, at the end of the 2021, we have this sort of data. I'm sorry, because I have here. Okay, here, these are data representing only the first 6 months of the 2021, and we are already here. So I'm here asking where will be at the end of the year, and we are expecting a great increase in the 2021 regarding the eating disorders. And this is the same data that we have regarding the hospitalization rate for eating disorders in the first 7 months of the 2021. And also regarding the number of access for suicide attempts by age and year. And as you can see here, in respect from the age range 11, 14, 15, and 17, and 18 and 25, we have already reached the same amount of suicide attempts of the other years, also if these are data coming from only this first 6 months of the 2021. So, but this is the reality. We want to understand if the impact that we have regarding the mental health disorders is the impact, the real impact, or can be considered just a sort of rebound or a return wave because these children and adolescents did not have access to the health services in the 2020. We have now 2 projects. One is funded by the National Child and Adolescents Guarantor Authority, and we are developing for the authority the recommendation and best practices that she has to give regarding in general, the psychophysical well-being of children and adolescents. And we are also developing best practices for parental and general population outreach strategy for mental health promotion, especially in schools at all ages. We had also organized several focus groups and auditions, as you can see here, involving all different professionals coming from the health sectors or social sector or educational sector. And also we had several auditions also with Save the Children and Caritas, UNICEF, and so on. We understood from this focus group that the services response, especially in the health sector, was highly dependent by the type of service, the geographical area, and also the impact of the pandemic in these specific regions. And the participants just say that the pandemic worsened the problems that already these services had before the 2020. Regarding the school response, unfortunately, we had this sort of crystallized the problem of the teachers crystallizing on standard teaching and evaluation methods, and it was absolutely not adapted to distance learning. We had the students have been asked with a high level of performances, and they had problems also with distance learning, especially for children and adolescents that have been were migrants or people with disabilities and so on. These were the kind of diseases that have been reported. Again, the eating disorders, suicidal ideation, attempted suicide and suicide, self-harm and heteroaggression, and especially regarding the diseases and difficulty at schools, as you can read here, the learning disabilities or difficulties, a great difficulty in attention and concentration, conduct disorder, and also difficulties in controlling emotions and school phobias, and several students refused to go back in the school in September. We are now almost starting an epidemiological study together in great collaboration with the Ministry of Education, and we are collecting data in 5 Italian regions and collecting data from over 7,000 students from age range from 6 to 18, just to understand the psychophysical well-being of children and adolescents in the school. And we just got also another funding from the Ministry of Health to directly apply in the schools some strategies to counteract and mental health and also addiction issues. And we are trying to understand if there is the way to define coordinated actions to prevent and promote mental health and coordinate and counteract addiction. We would like also to implement homogeneous actions on the national territory to avoid regional fragmentation within the national health system, and to create a well-structured and coordinated service network for children, adolescents, and families. And especially at school, we would like to encourage greater investment by institution through the national policies, include in all schools various professional figures, such as also psychologists, and try to overcome the old teaching methods, encouraging training strategies based on peer education, and also to teach to the professors how to understand the different kind of emotions of children and adolescents, and empower teachers in this sense. So in conclusions, I think that the right to care for children and adolescents with the neuropsychological disorders and their families remains largely unmet. And we really urge to have available and up-to-date data for monitoring and planning services, and also intercepting new emergencies in the different kind of Italian regions. And we really need a synergistic action to support the mental and physical well-being of children and adolescents in all settings. Thank you for your attention.
Thank you for this very interesting presentation. We lacked data on well-being, physical, psychosocial and physical well-being of children and adolescents during all the period of the pandemic, and we really urge to have a structured system to have this data at our disposal, of the policymakers and analysts. And I ask someone if there is question. Anyone? No? On the chat?
There is one.
Oh, yes. Come, please.
Can everyone hear me on the thing? I don't know. But yeah, so what kind of data do you collect in your epidemiological study on mental health? What questions are you asking, or is it still admissions, or how are you measuring?
In the school you are talking about?
For
the one from the last one that I presented, the ranging from 6 years to 18?
No, in the new one. So you said you were having...
Yeah. Okay. So there is a sort of technological database where we are collecting data coming from clinical tests such as the CBCL, and that is strongly correlated to the mental health issues in the population and the quality of life of children and also their families. So are like this and there is also one test from the parental stress index, because it's strongly correlated also, as you know, of the problems and of the children and adolescents at home. You're welcome.